I've recommended placement of a sling for stress urinary incontinence treatment based on your amount of leakage, the physical exam and diagnostic studies that we did while in the office, your symptom history, and the amount of leakage you have. During this procedure, you're given general anesthesia. A small incision is made behind the scrotum in the perineum. At this point, the urethra is identified. A sling is then able to be placed and secured to the urethra. A scope is then able to be placed and cystoscopy performed. The arms of the sling are able to be deployed under small separate incisions. The sling is then able to be tightened and secured. Then all incisions are closed. A catheter is left post-operatively. Procedure is an outpatient. The patient is able to be discharged home the same day from the recovery room. You will need to have clearance from any special medicine physicians from a heart and lung standpoint. You'll need to be able to stop any blood thinners or antiplatelets medications. If you're cleared to have general anesthesia, you will be cleared to have this procedure. This was the question that we just answered. Instructions I'll have you follow in the days previous and leading up to your procedure. We will usually have you hold antiplatelet and blood thinning medications. We usually have you not eat or drink the night before the surgery after midnight. Your times for check-in will be given through our scheduler in our office. Usually the anesthesia department potentially may have a phone interview and labs or needed tests before undergoing general anesthesia. The anesthesiologist in preoperative evaluation will provide guidance on medications that are needed to be stopped or taken. With respect to my operative procedure, I usually have you stop blood thinners and antiplatelet medication for a certain duration prior to the procedure. Before the surgery, we usually have you refrain from eating or drinking at midnight the night before the surgery. The next morning, you will check in. You shouldn't have had any smoking, mints, gum, candy, or solid food prior to. You should bring a change of clothes. You should bring your identification, and you should bring applicable insurance cards and information. You should bring a list of your current medications and a responsible party in order to provide transportation for you home and postoperative instructions. There's no need to shave before surgery. We'll perform the shaving after the induction of general anesthesia to help reduce infection risk. The day of surgery, you will check in downstairs in outpatient scheduling. You'll be brought in and taken to the pre-anesthesia area several hours before the surgery. At this time, you'll change clothes. You'll meet with the anesthesiologist. IVs will be started. Proper surgical consents will be signed. Preoperative antibiotics will be administered. You should call our office if you have any questions prior to this surgery. Someone, whether it be my nurse, one of our mid-level providers, myself, or our scheduler, should be able to answer most of those questions. In addition, the electronic patient record that has messaging component, questions can be sent through there and they can be responded to. For nervousness leading up into the surgery, I would just ensure that you have most of the questions answered, that you know what your expectations are. You've had your proper preoperative appointments.